What's going on, guys? Tony Maritato here, licensed physical therapist. And I want to talk about a couple other home exercise stretches that you could do for frozen shoulder. Because the reality is what you do in the physical therapy clinic 1 or 2 hours a week is awesome, but it's not going to compare to what you do at home the other 23 hours of the day. So having the opportunity to expose the shoulder, especially a frozen shoulder, whether you're in the frozen stage, the thawing stage, or even the freezing stage. Exposing the shoulder to light intensity, low intensity, repeated motions that don't increase pain, but do produce a little bit of discomfort is gonna go a long way in helping the shoulder recover maybe more quickly, gain range of motion more quickly, maintain muscle strength and mass. So here are two of my favorite ways to mobilize the shoulder at home using something as simple as a doorknob. So the first one is with frozen shoulder, if I'm limited in flexion, external or internal rotation, what I would do is I would grab the doorknob, and as I back myself away, now there's no way for the door to open because this is the way the door closes. If your door opened this way, I would go on the other side. But I would grab the doorknob as I kind of sit back into it. So this would be 0 degrees of flexion, arm at my side. This would be 90 degrees of flexion, arm, wrist in line with the shoulder. What I'm gonna do is I'm gonna grab the doorknob, and as I back up, it's actually creating a little bit of traction force. If you've been in therapy, your physical therapist probably has taken your wrist, gently pulled, given it a little bit of shake, and then as they're shaking it, they might be moving it up and back into flexion. This is basically the same thing, just without the shake. So as I lean back, I'm creating a little bit of traction through the shoulder. As I move further away from the door, even if I'm pressing down a little bit, the lat, the teres, the inferior musculature of the shoulder are working to open up the top space until eventually I can get my ear right next to my biceps. That's full range of motion. This position right here is the same as this position right here, full overhead flexion. So if you're working on flexion with distraction is probably one of my favorite ways to do it at home. You can add a rotation component because I'm leaning back and I turn the doorknob like I'm opening the door. Again, it's impossible for the door to open as long as it closes this way. I can go into a palm up position to get a little more supination through the shoulder, a little bit of external rotation. If I get external rotation, I will also get flexion. Those two movements work hand in hand, they work together. The other stretch is an internal rotation stretch. Now I'm gonna show that on the other shoulder just so that I can do it here while facing the camera. You might have been shown laying on your side what's called a sleeper stretch. That's an internal rotation stretch done this way. If I'm working either side of my body, I can work this. Basically what I'm trying to do is I'm trying to bring that internal rotation. That's gonna make it easier to reach across my body, behind my back, tuck my shirt into the back of my pants. But if I wanna work on this, I'm in this position. As I sit or slide down into it, that elbow goes up. I maintain good posture. My head, my shoulders, my hips are all in a straight line. I come back up out of it. Again, this is one of those situations where I would do this on the other side of the door. Just heaven forbid I twist the doorknob now, it's gonna open and I'm gonna drop back. I don't want something like that to happen. But what I'm doing is I'm coming down into this position, internal rotation stretch. I'm trying to maintain that neutral shoulder, keep it back. I'm not bending forward. I'm not doing anything kind of wacky with my posture. And then this would be something you might do 3 to 5 times, hold each position 3 to 5 seconds. We're just exposing it, the shoulder, the internal rotation motion, enough that we feel it, not to the point of pain. And so these are two of my favorite, flexion and internal rotation. I would do both sides. I'd maintain the health of both shoulders, maintain the mobility of both joint capsules, and I'll catch you guys on the next video.